On February 8, 2013, the Presidential Advisory Council on HIV/AIDS convened in Washington, D.C. During the meeting, members from UNAIDS and the Global Network of People Living with HIV sat down for a conversation with AIDS.gov about the Stigma Index and the impact of stigma in our response to HIV/AIDS.
Stigma is really both inward stigma, internalized stigma, as well as stigma that's imposed on you by others. And I think often the internalized stigma, the not wanting to be identified as someone living with AIDS or someone who's a gay man, drives you away from information, treatment, care, support, testing, and that's one of the biggest things that we have to fight.
And what the results show from other countries is that people don't get health care when they need it because they're afraid of how healthcare providers will treat them. And it's shocking to see what high percentages of people resist care or don't get care when they need it. And I've had that experience myself. I've avoided care when I needed it because I didn't want to go to a new provider and have to face their discrimination.
Yeah, and I found out I was HIV positive in the very beginning of the epidemic, and I experienced a surgeon who wouldn't reconstruct my anterior cruciate ligament in 1989. He literally told me, I'm not going to subject myself or nurses or other doctors to, your deadly disease just so that you can continue to play sports. You should go swimming. You should learn to swim. And I had a former employer force me onto long-term disability as soon as I got an AIDS diagnosis, even though I wanted to continue to work. And so even for me, who is a privileged, educated, white gay man who's always had access to health care, even I've been the victim of stigma.
It still plays out.
I like to say the Stigma Index is a research initiative that pairs the experts of academics with people living with HIV. It trains people living with HIV to talk to other people with HIV about how they experience stigma and how it interferes with their ability to access information, treatment, care, and support in the context of HIV-related stigma and discrimination.
This is the first time in North America that we've had an implementation of the Stigma Index, but it's been implemented in about 45 countries in the world.
For more information about the Stigma Index, visit stigmaindex.org.